And I would like to present the next speaker. Please welcome Stephen Gordon.
Okay, thank you everybody. It's amazing to be here. I don't often get to talk to groups of people this big, so forgive me if I... and I'm not very good at doing PowerPoints either, so we'll see how we go. Does this... Oh, the little light. The little light. I just sort of put this picture on, looking around the room, a bit like the UK. Most homeopaths are of the female sex. So this is your homeopath. This is your patient. A majority of patients up until now tended to be women, and they often bring children, except, of course, in Sweden, where it's illegal to bring a child under 8, which is, I mean, just ridiculous. So, let us move on. So really, I'm here to give you a kind of an overview, really, of what I consider, the homeopathy profession is an emerging profession around the world and in Sweden. I mean, my own history is quite interesting. 2 weekends ago, I went to a conference of the Society of Homeopaths in the UK, where we celebrated 35 years since the Society of Homeopaths was formed in September 1978. And it just so happens that in 1978, in September 1978, I was in the very first class of the very first college in homeopathy, which was set up by 2 people called the College of Homeopaths. So I studied with the College of Homeopaths, and then I went into practice in 1981. In those days, we had no clinical training. So we had lots of lectures. It was part-time. There was no clinical training. I was launched on an unsuspecting public and had to learn my practical homeopathy, my clinical homeopathy, with people who were paying me money to treat them. So it was interesting times 35 years ago, or 30. So I've been in practice ever since then until now. I'm much less busy now than I used to be. At my peak, I was seeing 40 or 50 patients a week, would you believe? These days it's much less, but that's partly because of the work I do for ECCH and ICH, so I've let my practice drop down. But I still love seeing patients, and in fact, seeing patients is a form of relaxation these days. I was a director of the Society of Homeopaths for 19 years, and in that time I served as a treasurer, the chairman, and then lastly my role was the political affairs officer. I did not have an affair with anybody during that time, particularly no one in government anyway. In 1990 I founded ECCH, and I've been the general secretary of ECCH and then ICH up until now. And I also have a kind of lobbying contract with ECCH, which basically I'll talk a little bit more about later in the presentation. So I thought I'd briefly start off with definitions of what is a profession. I mean, the Oxford Dictionary says a profession is a vocation, a calling, especially one requiring advanced knowledge or training, some branch of learning or science, law, theology, or medicine. I mean, I think we'd all agree that for most of us, homeopathy is a vocation. It's a calling. It becomes a calling. And then generally it's an occupation as a means of earning a living. And all of us do that, or we'd like to be able to earn a living from it if we could. And then simply a body of people engaged in a profession. But then there's a second level, a second degree of definition in the Oxford Dictionary. The declaration or vow made by a person entering a religious order. The action of entering a religious order, the ceremony or fact of being professed in a religious order. A religious order. A belief and obedience to the religion or faith, a religious system. Well, I put this in because I don't know about you, but when I discovered homeopathy, it was like a light going on. It was a bit like a spiritual awakening. And I think a lot of people have a kind of almost religious fervor about homeopathy, particularly in those first years when you discover it and you realize what an amazing system of medicine it is. And but the trouble is that religious fervor sometimes gets us into trouble, and it's important to remember and to realize that homeopathy is an art based in a science. And it amazes me how many people attach all sorts of other beliefs and things to homeopathy, things like astrology, for example, or I don't know, certain spiritual beliefs, things like that. But homeopathy is a science. It's a unique science, unto itself. You can attach all the other things you like to it, but sometimes people develop a religious fervor, which is not always healthy for the profession. And then lastly, another part of the definition is a function or office of a professor in a university or college, which is interesting when we think about where homeopathy's been going. We're also a liberal profession. I don't know if you know, this comes from the word profession libérale, and it's an occupation pursued in relation to an ideal of public service, requiring substantial mastery of complex skills and liberal arts of sciences, which cannot be delegated. Very difficult to delegate homeopathy to someone else. It's something you learn and you do yourself. It's an occupation requiring advanced technical knowledge, like law, medicine, and it also is these days interpreted by the International Labour Organization as a professional service. And that, I think, is what we offer. So we're a liberal profession offering professional services. And sometimes we need to remember that. I went to a hearing in Brussels, this hearing here, about the role and future of the liberal professions in Europe. And I was in this hearing. There were lawyers, doctors, dentists, all sorts of professions there. I was the only representative of the world of complementary medicine, interestingly enough. But all complementary medical professions are liberal professions. We stand up and can be counted alongside lawyers, doctors, dentists, etc. And I think we need to remember that and be proud of it. We're independent, we pay taxes, we charge fees to clientele. All these things are the hallmarks of a liberal profession. And it's interesting that in the EU directives now, they're looking at these practice on the basis of relevant professional qualifications in a personal, responsible, and professionally independent capacity. And I was just looking at this photo, I'm thinking, out of those 4 people, which is the homeopath? You got it first time, Lionel. And why? Because the 3 people behind are skeptics. Anyway, it was an interesting experience to be there and to be the only CAN professional in the room. And I made a presentation and I pointed out that across Europe, with the extreme difficulties that homeopaths and other CAN professionals have, on the basic EU treaty freedoms of freedom of movement and freedom of establishment. We cannot move from one country to another freely and set up a business or practice. There are all sorts of restrictions to our rights to practice across Europe, including, of course, the access to medicines. So homeopathy was defined by the British Medical Association in a report many years ago as a discrete clinical discipline. It's a discrete system, discrete meaning not something you do in private and hiding away from people, but it's separate and contained within itself. It's a system of healthcare with its own philosophical, methodological, and medicinal approach that clearly distinguishes it from conventional and allopathic medicine. And it merits a devoted, autonomous profession to practice it. In the past, homeopathy was very much, the flame of homeopathy was carried by medical doctors in many, many countries, and all tribute to them for doing it. But also in the past, there has been, you may know the history of homeopathy in America, for example, where there was a whole movement of homeopathic schools, colleges, and hospitals arose, and there was a whole profession of homeopaths, which was basically destroyed by the Flexner Report, where all the allopaths got together and brought in laws and regulations to crush the homeopathic revolution that took place in America in the 20th century. But anyway, this is my opinion on here. Some of you may wish to agree with it. It is not a subsection or a speciality of conventional medicine. It is a discrete system on its own, and that's what we practice. So therefore, we do it as an independent profession. So I wanted to talk a little bit about the evolution of homeopathy, with reference particularly to the UK. The UK is interesting because in the UK we have a legal system called common law, which basically says anybody can do anything they like as long as there's no law saying you can't do it. And this is in contrast to countries like France, where you have the Napoleonic system, which says you can only do something if there's a law which says you can do it. And so in England, we had a situation, it was an amazing situation. Prior to 1978 in the United Kingdom, most homeopathy, there was quite a lot of doctors. The Faculty of Homeopathy had trained and regulated a lot of doctors who practiced homeopathy. But there were very few professional homeopaths, and there was quite a few lay homeopaths. But there were very, very few people practicing other than the medical doctors. In 1978, the Society of Homeopaths and this first college, which somehow destiny decided I should be in, was created. And from that point on, there was a kind of an explosion that took place of interest in homeopathy. And so within the next 20 years, there was a whole lot of courses came into being, training homeopaths. There were a number of different associations being formed, because, again, no one had to join the Society of Homeopaths, and if someone didn't like the Society's way of doing things, they said, oh, well, I'll set up my own professional association. And you had people waking up in the morning and thinking, oh, I'll set up a college of homeopathy. So we had, at the end, something like 30 or 40 colleges at one point in the UK training people. And during this time, there was the government at the time had a system where GPs could actually employ and engage practitioners of complementary medicine, so a few homeopaths. Some of you may be familiar with Francis Treuherz, for example, who I think has come over and lectured over here. He was employed in GP practice. And then Andrew Ward. And, I worked in a GP practice, but privately, but I was working on the premises with GPs at the time. Anyway, all this explosion took place, and then in from 2000 to 2007, I was the vice chairman of an effort to try and create a single register of homeopaths for the United Kingdom, to get everybody around the table, all these different associations and all these different schools, to agree to a single register of homeopaths for the United Kingdom. And unfortunately, after 7 years and the spending almost £1 million, the whole thing failed. People pulled back at the last minute, partly through a lack of vision and partly through conflicts of interests, I will say, of various people sitting around the table. So sadly, we still have now separate associations of homeopaths. The Society of Homeopaths is the largest. And of course, all this took place in an explosion of interest in other complementary medicine things like acupuncture. And we had things like the osteopaths and chiropractors were registered and regulated by Act of Parliament. And so it was very interesting times. We had the Prince of Wales setting up foundations for integrated medicine and trying to get more integrated medicine into the NHS. So the Society of Homeopaths was created by a small group of just 10 homeopaths who were trained by 2 homeopaths in London. They were both doctors, but they were rather unusual doctors, and they were both druids. And they had these 2 little groups of people that they used to train sort of on a Monday night, or teach, I should say. They were taught. And 2 or 3 of them got together and decided to form a professional association and the first school in that same year in 1978. And I was in that school. It was a 3-year course in those days, and I graduated in 1981, and I joined the Society's register, and I also joined the board, because the people that set the whole thing up weren't really interested in bureaucracy and administration. So that as soon as there was 2 or 3 graduates, such as myself, they got us onto the board of the Society of Homeopaths, and they jumped ship, and they went off and did other things, like run the college, for example. So you can see the growth in membership. In 1978, there were 12 members on the Society's register. In 1981, with the addition of the graduates, there was 21. By 1995, there were 405. By 2008, there were 1,500 members on the Society's register. And now there's about just over 1,200. So there's been a drop-off, partly because of the economic crisis. There's been a sort of, and also partly because of all this skeptic business that's been going on in the UK, which you're probably aware of. And student members similarly. The society has a category of student member, and at one point there were 700 students registered with the society who were studying in the various colleges and schools, and that's now dropped down to 150. So during those years, we started doing postgraduate training, continual professional development, and they were amazing years. I used to run the conferences for the Society of Homeopaths, and I had the pleasure of in introducing people like Votulkas, Vasilis Gegas, Francisco Aiziaga, who's sadly no longer with us, Eugenio Candegabe, who has also passed on, Rajan Sankaran. Those years were amazing, and there was just an explosion, as you probably know, many of you, in the knowledge and understanding of homeopathy. And of course, we began to have our own teachers come from within our own community. Jeremy Scher, for example, who I see you've got coming here soon. Misha Norland, David Mundy, Miranda Castro. With our own community, we had our own teachers coming and developing. So the Society of Homeopaths is now in a very stable situation. It's got a full-time office with a number of permanent full-time staff. It's got all the committees that you need, on research and all sorts of other matters. A registrar, professional conduct. We have a journal, a newsletter, and the society regularly engages with the government and the Medicines Agency and things like that on all the matters of concern to homeopaths. During all this time, we also had some fun. These are some pictures that someone sent me literally 2 days ago, completely out of the blue. Rob Barker, on the left there, he set up a company called the Homeopathic Supply Company. One of the things that a profession does as it grows is that people spin off and do different things. Some become researchers, some become teachers, some set up businesses. He set up a business called the Homeopathic Supply Company, which is now a very big business with a large turnover. And he set it up as a complementary business to the business that this gentleman here set up, who you may recognize, John Morgan. This is him in 1991. This is us in 1991. The chap in the stripy blue shirt is me, if you haven't realized. And he set up Helios, and I remember him in the College of Homeopathy in the early 1980s. John Morgan turned up with another homeopath called Stella Berg, and they started to hand make remedies. And they came to the College of Homeopathy, and they sold a range of 20 or 30 handmade succussed remedies, and that's how we started off Helios. I mean, he was a trained pharmacist who got into homeopathic pharmacy. But he was so passionate, and he trained at this college, and he started to do this. So that's how Helios started, and you know now how big Helios is. It has a worldwide market. I know many of you buy your remedies here from Helios, and they do a fantastic job. Shh. And So Rob Barker set up his business. Now, Michael Thompson, the gentleman here in the forefront of this photo, he set up the very first McRepertory franchise in the United Kingdom. When McRepertory first came out from California, when David Warr Kenton first developed it, he was right up there. So we're talking in the late 1980s, 1991. Together with Francis Treuherz, they set up the Homeopathic Bicycle Company. And they were the first franchise for McRepertory. So, and the gentleman behind, we all used to do cabaret at our annual conference. We used to put on a cabaret, and we'd all dress up in costumes and sing silly songs about homeopathy and have a very good time. Anyway, so one of the things that happened is that the society began to develop an interest and a competence in the area of research. In those days, there was very little research around. I mean, Peter Fisher, who has been here today, I mean, he has been a constant force in research for as long as I can remember. And he's been editor of the journal Homeopathy for as long as I can remember as well. But there were very few index papers in those days. In the 1980s, there were a few more published annually. And then between 1900 and 2000, there was 100 papers a year. And these days, we get about 200 papers a year. So the research database is gradually growing. So when I was on the board, we formed a tentative research group, and then it kind of didn't really have much to do. It didn't know what to do with itself, really. I mean, we didn't have the competence to carry out research ourselves. So then it sort of went into abeyance. 1992, we set up we re-established a research group, and then we began to hold events. We decided that we needed to educate our membership and give them a research awareness, an understanding of research and why it's important. Because each of us is a researcher. Every homeopath is a researcher. Every time you take a case and you prescribe a remedy, you are researching for homeopathy, for your own personal practice, but in the wider sphere. So we set that up, and then we had the first symposium on research methodology in 1993, and then we carried out a service evaluation of SOH members' practice. How many patients, how many clients do you see, what kind of remedies do you prescribe, etc., etc. And then we held symposiums, and then we formed an SOH Research Ethics Committee in 2003. This was because some of our members began to want to do research. And normally with research, if you want to do it, then you need to pass your protocol, your proposal in front of a research ethics committee, which vets it to make sure that it's ethically acceptable in the way that you're going to administer your treatments to the patients, etc., etc. So then in 2003, the Department of Health, as a result of a report which came out from the House of Lords in 2000, put up some money to do what we call capacity building. Capacity building is where you actually build up people's education, ability and competence to do something. And this was capacity building in complementary medicine. And 2 society members got funding. Elaine Weatherly-Jones and Claire Relton was awarded a PhD studentship. As a result of which then Claire went on in 2007 to do a full national service evaluation of homeopathy. And in 2007, the gentleman at the back with the funny French accent, Alex Tournier, was instrumental in establishing the Homeopathy Research Institute. Hooray! And of course, another member, although he's not with the Society of Homeopaths, Lionel Milgram has been also a very influential figure in research, particularly in the area of fundamental research. The Society set up research pages on its website, which are now very comprehensive. If you want a good kind of rundown of the whole research scene, the fundamental research, the clinical research, etc., the Society of Homeopaths web pages are a very good resource for that. And then we employed a research consultant, Rachel Roberts, who is now associated with the HRI, very much so. But research is very important. For example, we have had all this business with the skeptics in the United Kingdom. And what the skeptics have done is they've gone around targeting homeopaths websites, and then they complain to the Advertising Standards Agency, the ASA, and they complain about the websites and the claims that homeopaths make. And they also complained about the Society of Homeopaths website and claims that were made on the Society of Homeopaths website. As a result of which the Advertising Standards Agency carried out an investigation and passed a judgment on the contents of the Society of Homeopaths website. And it was very important to have someone with a really good research background and briefing to be able to go and defend with the ASA what their charges were. So it's really important. I don't know whether this is happening here, but this is a very nasty thing that's going on in the United Kingdom, where these skeptics are attacking every aspect of homeopathy, whether it's the medicines, whether it's individual websites of practitioners, whether it's the websites of society, even the course providers. You may hear tomorrow from Jean about the UCLAN, etc. It is a very, very nasty situation we have here, and these complaints go to the Advertising Agency, and they make rulings where you cannot say this, you cannot say that. So research is very important to be able to try and back up what you want to say. So here we have the Homeopathy Research Institute, which is a great initiative because it brings together the research talents from the communities of the homeopathic doctors, because research has been dominated by the medical homeopaths and researchers up until the last 10, 15 years. But suddenly, as we grow, as we emerge as a profession, out of our ranks emerge people who are interested in research and with the competence to do research. And very often, because people already had previous careers, like Alex, for example, was a physicist. Before he got into homeopathy, they merged those talents. So, and then, of course, the fruit of that was this conference that a number of, I know Brigitte attended in Barcelona back in May, which was a really wonderful event. We brought together all the current knowledge and understanding of the research situation in Europe. So you'll see the trustees, you've got a mixture of R.S. Homs, which is the Society of Homeopaths, not qualification, but the registration letters, Dr. Claire Relton, who now has a PhD, Peter Vixveen, who now has a master's, Peter, he's here, and Dr. Elizabeth Thompson, an MD, wonderful homeopath that works at the Bristol Homeopathic Hospital. And then they have an advisory committee, again, a mixture of researchers with PhDs, Dr. Iris Bell, MD and PhD, Dr. Peter Fisher, Maury Hyers, Hugh McPherson, who's made a whole career in he started off in acupuncture. But his research catalogue now, I mean, he's been really doing all sorts of stuff to do research methodology, as is Claire Relton. Claire has moved on from just homeopathy to doing more abstract and theoretical stuff to do with research methodology. So again, you can see that coming out of this emergent profession, there are people making their mark in these different areas. Similarly, with education, there was this huge growth, and all these colleges were popping up all over the place. So the society decided to introduce an education, first of all, an education policy, and then to set up an accreditation or recognition process where you evaluate courses according to your criteria, and you recognize and accredit them. And that, which means basically that anyone who graduates from those courses can move straight onto the register of the Society of Homeopaths without having to go through some sort of extra assessment. So in 1988 there were 8 colleges, and then it moved to 17 recognized colleges, and now with this decrease in students and practice for various reasons, is now down to 10 recognized colleges. And they can put this sign on their literature, Society of Homeopaths, recognized course provider. And then in 1988, some of the colleges began to engage with universities to seek degree accreditation. The first one was the London College of Classical Homeopathy, which had its course validated by the University of Westminster. They developed a BSc honours degree in homeopathy, which was a huge step forward, because it brought together researchers, medical doctors and homeopaths to create a really solid curriculum which had a good scientific basis, a good medical basis, and had all the essential homeopathy. You'll note it was the London College of Classical Homeopathy, so it was the homeopathy was good. And then the next university was that of UCLan, and as I say, that's another story, and you're going to hear that story tomorrow from Jean, who's going to tell you all about the UCLan experience, so I'm not going to dwell on that any further. Then we had the formation of the European Central Council of Homeopaths, or then, as Brigitte, I think, said, we called it the European Council for Classical Homeopathy. I won't go into reasons why, but essentially, years later, I wasn't very happy with that title because it didn't really say what we really did. The European Central Council of Homeopaths is a professional platform for the homeopathy profession at European level. It is not about defending classical homeopathy. So it was initially formed by, I don't know, I more was instrumental in calling the very first meeting. I'd heard about an old association in Norway, the Norske Homeopaters Landsforbund. There was a couple of associations in Germany, there was a couple in Holland. And so I contacted these people, and we got together in Holland, and out of that formed ECCH. And Andreas Bjorndal, who I'm sure most of you are familiar with, was made the first chairman, and I became the general secretary. And 23 years later, I'm still the general secretary. Anyway, the first thing we did was to sit down and create a recommended core curriculum. That was the first thing we thought was necessary, was to write a recommended core curriculum of the education and training of a competent homeopath. And we did that in 1993, and we published the first set of guidelines. ECCH now represents 27 associations in 25 countries, and ICH, which we reformed in 2007, includes all the ECCH national members, plus we have associations in Africa, Asia, Australasia, Europe, and North America joining us, and they're popping up. I mean, Japan is a hotbed of homeopathy. It's incredible. We've had a new association approach us from Hong Kong. They've got 400 students in training. I mean, so homeopathy and the profession is growing and emerging. And the ECCH has produced all sorts of guideline documents, guidelines on accreditation, continuing professional development. So these guidelines are there to help facilitate and support the emergence of professional associations all around the world. Whatever countries, these documents are there to aid and assist them. And I have to pay a huge tribute to Peter Vixveen, because it was Peter, while he was chairman, that helped us to bring all these guideline documents into being. He was a wonderful chairman of ECCH. Are you here, Peter? There he is, hiding at the back as usual. But Peter did a fantastic job as chairman, and all those most of those documents you can attribute to his constancy at the chair. So, we have this common basis now, and we're now working on something called occupational standards. In the UK, they developed a document called Occupational Standards for Homeopathy, which describes what it is a homeopath does. And we're now looking at creating a European and international occupational standards. Meanwhile, there's a new initiative which we've been made aware of, which the homeopathic doctors have engaged in, which is a European agency which is now establishing standards for healthcare across Europe. And that has a kind of, it's a currency which has weight because it's endorsed by the European Commission. So we are now looking at that for ECCH. Basically, I said I have a lobbying contract. I do a lot of work at European level. We're a member of a number of organizations. We work with the European Public Health Alliance, which is the big NGO for public health. We're a member of it. We work with the European Coalition of Manufacturers. The manufacturers, ECHAMP, you may be aware of them, they have all sorts of concerns about the way that the directives are implemented in countries like Sweden, in different countries, because it affects their sales. I mean, their prime concern is sales of their products, and they have problems. The heads of agencies, Homeopathic Medicinal Agents Working Group, which you referred to in your speech, they're having a hearing in November, on November the 20th in Bonn, in Germany, and I shall be there representing ECCH, and we have the opportunity to make a presentation about the problems we have. So I would like to hear from you in Sweden about the problems you have here, and maybe you'll be there as well. Eurocam, we've joined Eurocam, and that is a stakeholder group of CAM providers from the medical CAM providers and the non-medical and the patients. And of course I'm going to talk about Cambrella tomorrow. So in the Commission, these are all the concerns of the Commission at the moment: antimicrobial resistance, healthy aging, chronic disease, health workforce, patient safety, health information, health literacy, cancer, and health inequalities. We have something to say, and we have something to offer on all of those subjects. 2 days ago, we had an exhibition, this is Eurocam, in the Commission in the Berlaymont building in the middle of Brussels, all to do with cancer, complementary medicine and cancer. And that's me. We had a conference in the European Parliament. There's Tonio Borg, the Commissioner for Health and Safety, Health and Consumer Affairs. There's two MEPs, Sirpa Pietikäinen from Finland, and Ton Nicolai, who is from the European Committee for Homeopathy of the homeopathic doctors. And we gave presentations to a meeting about the complementary medicine and cancer. In Portugal, they've just introduced a new law, zero for me, a new law, just over a month ago, which statutorily regulates 7 complementary professions, including homeopathy. It gives them technical and ethical autonomy as practitioners. They're not linked to medical doctors. There are certain requirements they have as practitioners. They will eventually all have had to have a university training, a university standard training. Professional titles will be reserved to people on the national registers. No one else will be able to call themselves homeopaths. And they've got transitional arrangements for people who are moving through. In Ontario, in Canada, they too are virtually at the same point as Portugal. They are bringing in a register specifically for homeopaths. The Homeopathy Act 2007 regulates and legitimizes the homeopathy profession in Ontario, Canada. It may not sound like a lot, but it's a really important precedent. So my point is this. There is an emerging profession called the homeopath. It's a liberal profession. It's successfully developed voluntary self-regulation. It's an internationally recommended common curriculum. We're developing a set of commoners and standards. We're developing a track record of homeopaths researching their subject. It engages a field of political activity relevant to its interests and to the health of patients and citizens. It's now beginning to be statutorily regulated in a number of countries. And so therefore, to repeat, there is an emerging profession called the homeopath, emerging in each country in its own way, as part of a whole world phenomenon. So just for a bit of gender balance, the last photo is a male person consulting a female patient. And she's saying, homeopathy is wonderful. Where can I go and study it? And he's thinking, oh no, not another female homeopath. Anyway, thank you. It's goodbye from me. And it's goodbye from him and from her. Melanie Hanneman, probably one of the first trained homeopaths, not a doctor. And she is one of us. So thank you very much.
Thank you, Gordon. We have time for one question, please.
Too stunned.
Yes.
I think I have a few that I would try to put into one. What do you see the future of homeopathy in Europe with all the pressure that we have from the normal medicine, like the allopathic medicine and all the money that they have? And the kind of other question that you addressed a bit in the end was, do you see a future where we would have universities where you could actually study homeopathy here in Europe, like they do in India, for example?
Well, I mean, first of all, you'll hear tomorrow about a whole thing which went down in England to do with universities, where we did have a number of university degree courses. And there is still one running, actually. In Portugal, they put in a requirement that homeopathy and the other 6 disciplines with it will have to be taught in universities. I mean, make no bones about it, homeopathy and an education in homeopathy is of university level. You know, it is a university level education, so it should be taught at university level. So, but, you know, there's a long way to go. Now, you ask about conventional medicine. You've got this list of things here. This list I gave you earlier on. These are all the things which the EU is having to deal with. And these are not able to be dealt with by conventional medicine, not with drugs and surgery. Because this is all about the prevention agenda. I mean, the monster of antimicrobial resistance has been created by conventional medicine, its overuse and misuse. And they have to start looking at other ways of doing things. So herbal medicine, homeopathic medicine, etc. These are options which we are communicating with the Commission and the European Parliament about right now. So, and there's something else which is going on, and that is conventional medicine itself is having to confront a kind of internal meltdown. I mean, you heard this morning about the situation in in the health system in the United Kingdom. It is shaking. It is cracking. There are all sorts of scandals to do with corruption in the drugs industry, for example. False data which has been withheld. There's a big campaign launched by someone who was a homeopathy skeptic, probably still is, Ben Goldacre, called All Trials, calling for every trial should be published, all the information should be available. Because then we will know what the true story is, because the drug companies have been holding back the negative data for years and years. You may have heard that in China, GlaxoSmithKline, I think Novartis, are up for huge corruption issues to do with the way they push the drugs in China. So these things like chronic disease are not going to be addressed by conventional medicine. I mean, you heard they had the example about statins. I mean, now they're developing vaccines for everything. They're desperate. So conventional medicine had its own internal problems. It is actually, in my view, slowly collapsing from within. Not because of us, but in the sense, we're kind of waiting in the wings, because our message of holism, prevention, that whole thing is something that has to be, we have to shift the paradigm. And people in the EU are beginning to realize this. The paradigm has to move away from treating diseases with drugs and surgery to prevention of diseases, with restoring people to health, maintaining health. The physician's only and highest aim is to restore people to health. So there are a very interesting time. So we've had, I mentioned in England how things have shrunk in homeopathic time. But why are we being attacked? We wouldn't be being attacked if we weren't posing a real threat to the system, and they don't like it.
Thank you very much. Thank you, Stephen.